I am Dr Vamsidhar Kedar. I am a consultant pediatrician, pediatric intensivist, and allergy and asthma specialist with Lotus Hospitals for Women and Children in Kukatpalli. So today we have a discussion about the newborn care. I do hope that everyone gets a good idea about it on India on TV. I would like to thank the India on TV to give me this opportunity to discuss about these burning issues as of today. Today we are here to discuss about certain aspects of newborn care. The first and foremost, the most important thing is the routine newborn care that is to be taken for all the newborn babies. Second part of the discussion is about the vaccinations, and the third part of discussion is about the growth and development. Firstly, regarding the basic newborn care, the most important thing is the feeds. Primarily in the feeds, we will be discussing about the breast milk care. The most important feed for any newborn child is the breast milk. Initially, for the first 2 to 3 days, it is slightly difficult for the mother to express the breast milk and give it to the child. And it is also difficult for the child to start the suckling, as the child will get used to the recent and the extra partial life. Initially, to start off, the breast milk should be given to all the babies. Breast milk is the most important milk. It contains all the immunological factors essential to fight a lot of infections like the stomach infections, the respiratory tract infections, and also it has protective factors to fight against allergy and asthma. Secondly, initially for the first 2 or 3 days, the adequate quantity of the breast milk may not be secreted by the mother. A thin whitish liquid might come out. That is called as colostrum. This colostrum is very rich in immunological profile. It improves the immunity of the child and thereby prevents a lot of infections that are usually seen in the later life. Among these, the most important thing is the prevention of diarrheal diseases and also the prevention of respiratory tract diseases. It increases the gut immunity and the respiratory immunity, thereby preventing all these infections. And breast milk also contains a lot of brain protective and brain developing factors also that will lead to a very positive enhancing effect for the child. Second important thing that we will discuss is keeping the child's temperature regulated. That is taking the thermoregulatory mechanisms. Care is to be taken to give a lot of warmth to the child. Warming the child doesn't mean that we need to really warm the child. Wrapping up the child in good blankets or bed sheets or keeping the child in a baby bag is very, very essential, because the baby's skin is very, very gentle, fragile, and it doesn't contain the amount of subcutaneous fat or the subcutaneous tissues that usually adults have. So the temperature transmission across the skin is very, very large. So due to this, temperature fluctuations are very commonly seen in the newborn babies. Here, the child needs to be warmed, kept wrapped well to control this temperature regulation. Any change in the environmental temperature will have a detrimental effect on the child's temperature regulatory mechanism. And when compared to the older children, the child's temperature, the newborn's temperature regulatory mechanism is not as well developed as the adolescents and the adults. So care should be taken to give a thermoneutral environment to the child. Thirdly, we would give about the infection control. In the infection control, lot of factors have to be taken into consideration, because here infection control doesn't only mean the giving medications. It also means how to handle the child. Before and after handling the child, care should be taken to wash the hands thoroughly with soap and water. Hand wash is found to be the most important thing in prevention of nearly 80% of all common infections. And minimal handling. Care also should be taken not to allow too many visitors to come into the vicinity of the child. We have lot of visitors immediately after the child is born. And after the newborn comes into the family, lot of people come and visit the child. In due course of time, lot of infections can be spread to the child. So minimal handling and strict infection protocols have to be kept in place. Infection protocol sincerely means a rigid and strict hand washing technique should be emphasized in such a way that the infections are controlled. Hand washing is found to decrease the transmission of common infections by more than 80%. And minimal handling by visitors is also very essential. Lot of visitors should not visit the child. The room should be well ventilated, not closed completely, and minimal visitors should come to see the child. This would help in preventing lot of infections. Another most important thing is bathing to the child. Lot of myths and doubts have been there regarding giving bath to the child. So a bath should be given to the child almost every day, because skin is a very important medium for transmission of infection. Care should be taken to apply a gentle oil over the skin, and a gentle children's soap should be used, followed by a lotion to prevent the loss of heat after the bath. So a daily bath is essential not to allow any bacteria to settle on the skin and thereby provoking the infection. Another most important thing that we usually see in the newborns is the jaundice. Here, the jaundice is commonly seen in the newborn children in almost 80 to 85% of normal newborn children. Jaundice is very common finding in all the newborns, but there is a certain level above which it requires a specific form of therapy. Jaundice is usually of two types. One is the non-infectious source of jaundice and another is the immunological source of jaundice. I mean immunity here is the blood group of the mother if it is different from the blood group of the child. So there are only very specific blood groups interaction that might cause the jaundice. Another very important reason for jaundice is the dehydration jaundice. Dehydration means due to the various temperature problems in the environment like summer months, and due to the water intake which is absolutely absent in the newborn children, the blood becomes concentrated and the bilirubin shoots up. The jaundice shoots up. This is where we call as the heat jaundice or dehydration jaundice. Here, the only treatment is giving more surplus breastfeeding to the child. Over and above this, jaundice, basically over and above a specific level, it is detrimental to the brain. Hence, some form of treatment has to be given. Normal jaundice is usually seen from the 3rd to 5th day of life, and then on it goes on increasing till the 8th and 9th day and then falls off. If it goes beyond a specific age related level, then a treatment is required which is more of a in-hospital treatment. The treatment includes keeping the child under a specific blue light which actually dissolves or changes the wave pattern of the bilirubin, that is jaundice, and helps it to come out of the body. Any jaundice which is seen on the first day of life is usually because of some other bigger problems. Jaundice seen after the 3rd or 4th day is usually not so significant.